Hi everybody, I'm Wendy Blair. I'm a member of the City Women Network Marketing and Communications Committee. I'll shortly be talking to my friend Sue Hunt in this In Conversation With event about domestic abuse awareness. Before I introduce Sue though, it's worth saying a bit about the City Women Network and particularly our series of courageous conversations. The network is a members organisation that was established over 40 years ago for professional women to connect, develop and grow. And it's a diverse community and in fact the longest standing women's network in London. This year we're focusing on a series of courageous conversations to encourage discussion around difficult subjects and to try to help make the uncomfortable comfortable, if you like, while also offering some practical advice. Our first courageous conversation focused on, as the UN is describing it, the shadow pandemic of domestic violence. You can watch a video recording of that event on our website, citywomen.org. And building on the insights shared by the incredible panel in our first courageous conversation, today Sue and I will be talking more about ways to support colleagues, friends and family who might be suffering in silence. So a big welcome to my very good friend Sue. So thank you for being here. And I'm really delighted to be having this conversation right now as Sue starts an exciting new chapter, transforming years of volunteer work with domestic abuse charities alongside her super media career into a full-time mission. So Sue, I think maybe the place to start is if you could talk to us a bit about how you started in the domestic awareness volunteering space and how you've come to be doing what you're doing now.
Yeah, thanks, Wendy, and thank you for having me. It's an absolute pleasure to be here, of part of such an important, courageous conversation. So great work that the City Women's Network is doing. I guess, yeah, my involvement started way over 20 years ago now when I was at university, and I actually used to volunteer for Women's Aid, ironically as a minibus driver, and we used to take the children who were staying in refuges out for day trips to give them a little bit of freedom, but also some respite for their mums. And I guess it was back then that I was less aware of domestic abuse, but it was very clear to see from working with those children and spending time with them what the impact of this can be, both emotionally and behaviourally, on the children that grow up with abuse. And from there on, when I moved to London, I became involved with the National Domestic Abuse Helpline. I volunteered on that some years ago. Did indeed take a break and have spent time in media and advertising building my own career. I actually came back to the helpline some 3 years ago as a volunteer, but it's been really through the work in lockdown that has made me rethink what I want to do and where I want to spend my time and really work a lot more involved in this cause. It's very close to my heart. And I think I'm motivated by the fact that it's such a man-made problem. The impact of domestic abuse is massive. The estimates are that it costs the UK 66 billion a year. And it is something that we can reduce and certainly support through awareness and training.
That's a huge number. I mean, what is the scale of the problem in the UK in terms of percentage of people affected, that kind of thing?
Yeah, the absolute number is over 2 million people a year. So 2.3, 2.4 million people a year are impacted by domestic abuse. If you look at the stats through our lifetime, according to the ONS, 1 in 3 to 1 in 4 women will experience domestic abuse in their lifetime. And I guess to where I started to notice the impact, up to 1 in 5 children, which is horrifying. And by no means to say that men also don't suffer. 1 in 7 men in their lifetime will experience domestic abuse. So the numbers are huge. And as you've already mentioned, this is something of an epidemic within the pandemic. And the numbers are now starting to come through a year on to show how much worse the problem has become in the last 12 months. The National Domestic Abuse Helpline themselves have reported a 60% increase in calls through that year. And the police are reporting a 7% increase in offences reported. And if we think about that number alone, while 7% feels relatively small, if you think about the reality of your ability to seek help and go through a legal process when you're in lockdown, 7% is actually quite significant, when many survivors will feel less able to seek help.
Are we talking about particular communities or demographics here, or is that a more across the board problem?
It's a really good question, and I think it's hard to deny that this is gender-based. So, as we've already talked about, statistically, more women suffer and more women are survivors of abuse than men. And I personally do genuinely believe that there are some physiological reasons for that. You know, the 30% of abuse starts or escalates during pregnancy. As a result of pregnancy and childcare, women often take a step back from their careers. So they're more susceptible to financial abuse if they don't have the same earning power, let alone the obvious opportunities of sexual abuse and physical abuse where men are in that position of power. I think if you look into the variation in cultures, I'm not sure there is a difference. I think it's more the legal support and the social acceptability of talking about the abuse and declaring it. I think we still suffer from the stigma that abuse isn't happening if it isn't physical, where in actual fact, the essence of abuse and what motivates a perpetrator is power and control. So that power and control can come from any means: psychological abuse, emotional abuse, financial abuse, as we've talked about. Technical abuse is getting worse with the advent of social media and our reliance on mobile phones. And I think specifically in this case, as we've already seen with Mira's story, I think her mum herself said that she felt it was harder for Mira to disclose and seek help because there were cultural pressures from the South Asian community. And I think that still runs true with many communities. There are still many countries, races, ethnicities where there is a cultural predication, and we're still very much in a patriarchal society. So society prevents women from getting help, let alone whether the country's laws or systems are there to help them through.
Okay,
it's a very long answer to a relatively simple question, but
well,
I think as that says, there are many, many facets of this, hence it is such a wide-reaching problem.
Yeah, it's a really complex issue across the board, I think. What sorts of things can we do to recognise potential problems in colleagues or family or friends, that signs that might indicate that there's a problem?
Yeah, it's a really good question because it's such a delicate area. I think, again, with the legacy stigma that abuse has to be physical for it to be real, there's also that rather simplistic view of the world of why don't you just leave him? But I think if we really think about that earlier point of how complicated and wide-reaching abuse can be, because it is about control, it's not about physically hurting someone. The most important thing I think somebody witnessing or suspecting they're witnessing abuse is just be patient, be supportive, and really try and open up that conversation. Really important to understand how that woman is feeling. And in the mainstay, the most common feature of abuse, I think, is that she gets the blame. The perpetrator will always blame the survivor and turn the responsibility onto them. So that deflection is often the thing that makes it harder for them to take action. So for them just to feel listened to and believed and supported is the most important starting point. For them to have acknowledged the abuse in the first place and be ready to admit to it is huge. To then talk about it is so important. And for them to feel free to talk without judgment, without instruction, and equally without any of the control that they're already living with at home.
And you talked before about lockdown and the increase that the helpline has seen, particularly, and the police. Are there signs, while we're still on online meeting scenario, obviously we'll be moving back to the office, and we're, actually seeing people might make it a bit easier to get a sense that something's wrong. But are there signs that you can look for whilst you're on calls with people, for example, that something might be going on at home?
Yeah, that is a really good question, because I think you probably can still see some signs. I think it's a little bit easier in the work environment, and there are some traits that employers have reported. So I think there's something like a 56% likelihood of absenteeism in a survivor of abuse. Timekeeping, lateness, whether late in the morning or needing to leave early in an evening. Things like that are quite common. An unease, very obvious signs of distress or fatigue. Something like 85% of survivors of domestic abuse also have mental health problems, completely understandable. So think of it as maybe signs of anxiety or depression that might be feeding through. Common form of abuse around the psychological aspects and the financial abuse are making the woman take sole care of the children. So you may get a sense that she seems to be carrying an unfair burden, that children are omnipresent in the working environment, or really, really simply, her camera may be off. That's missing meetings, certainly missing meetings out of traditional working hours, or not wanting to be visible could be a sign that something's not right in the domestic environment.
So we can listen, if someone opens up to us, we can listen to that. Is there a responsibility on us to then do something about that? For example, by reporting to a manager or HR, or even to the police if it's criminal? Is that something that we should be thinking about, or is it on us to hold that information and wait for?
Yeah, it's a good question, and the way you're framing it is a delicate one. You'd love to be able to intervene and do something about it, but it's a little bit back to the earlier point that that person has to be ready to talk about it themselves, partly because they need to feel the confidence and the empowerment to make their own changes. So it's their own, I guess, journey of rebuilding their confidence and rebuilding everything they've had taken away from them. But it's also think twice about whether you're adding risk. So if that person isn't ready to talk and suddenly the police are turning up at the front door, or they have a sense that other people know what's going on and might be judging them, then you can very, very easily make the problem worse. I think the best advice I could give is to just work really patiently and really non-judgmentally to try and get that person to go to their manager or to go to HR or go to specialist services, whatever, but to go and ask for that help themselves rather than you doing it on their behalf. And then the net result of that, I think, is more powerful anyway. It may take them longer,
but it's their choice.
It's their choice, and they're more likely to come through and make important and real change at the end.
And so in a broader sense, then, what should organisations, what should our employers be doing? What sorts of things can be put in place really easily to support survivors to either have those conversations or seek help while they're at work, perhaps?
Yeah, I mean, it doesn't need to be complicated. Again, we've got a huge gulf in this 1 in 3, 1 in 4 women survivors, over 2 million people a year. But only 5% of organisations have a policy or guideline in place. So there's a huge gap there with the number of organisations that are really demonstrating that they understand and take this problem seriously, which I think absolutely is understandable with the stigma that still exists, that if it's not violence, it's not happening, and the unease. We all feel like we're walking on eggshells, the survivor, but also the people who are trying to help. But that's not to say simple things can't be put in place. The absolute basics are to make it clear that help is available, signposts to the specialist services, the National Domestic Abuse Helpline, the Men's Advice Line, make those places really clear in your public areas, in kitchens, reception areas, on intranet sites. Make sure there is a safe space in any organisation that you can call. There are still many, many organisations that don't have completely private meeting rooms. So just making sure that there is a completely private phone booth in an office so that someone can go and make a phone call without interruption or without anyone earwigging. And then I think there are more detailed and more holistic things that can be put in place. If you go to the level of, say, as Facebook have done recently, and good on Sheryl Sandberg for using her fame, I think, to bring this to the fore, especially in America where the laws are terrible, providing paid leave. So that if a survivor is needing to leave home, find a new place to live, find a new school for the kids, seek legal help for divorce and separation, that takes time. If they can do that knowing that they're supported and paid, that's hugely significant. And then I think back to your question earlier about what you do with HR, managers, etc., that can be anything from training just the individual people that may be that first point of declaration, or company-wide training programs to understand both how that survivor is feeling and how they need that safe space to disclose, but also going a little bit more detailed into understanding where you can help them. What are their legal rights? What are their housing rights? There's probably only 5 to 10% of that information you need to know to make a really significant difference to that person's life.
So for the 95% of organisations that don't have any policy, is that the place to start? Is in, I guess, creating a policy and then building on that from there? And then that's what people like you are doing in a specialist way.
Yeah, and 100%, because I think there will never be a one size fits all. I mean, I've gone through all of this process as I build up my programs. You think so many huge organizations, retail, all of our supermarkets, the irony of even call centers, the hundreds of thousands of people they employ that physically can't make a phone call because it isn't the nature of their working environment, versus to many of the companies that we all work for that are highly skilled, highly professional, but still actually quite patriarchal. How many of our organizations still have very male-dominated management teams? So the willingness to raise awareness is a little bit lower. Perhaps there's even a level of banter that we put up with day to day that really treads a fine line in making people feel that they're in a safe place to disclose. So the range of support is huge, and really can range from very, very simple to much more detailed, in depth, and more fully funded.
Are the charities, the domestic abuse charities, doing this kind of work as well, or is this a kind of new area that you're sort of branching into?
There absolutely are organisations that do it. Women's Aid have a really strong training section, but they tend to focus within the sector. So training, say, the police and social services, which is enough to keep them busy with updating laws and policies, let alone new people coming in and out of professions. And there's another organisation called Safe Lives that do it. There's an organisation called the EIDA who have specific downloadable toolkits for employers. So absolutely there are pockets, but I don't think there is that holistic offering where you can look at both your paper policies, but also the way you infiltrate that through your culture, right down to the sympathy and the empathy required to support the survivor rather than just put a policy in place.
Yeah, and starting to help remove the stigma. It's crazy.
And then so simple, just changing our terminology. As I mentioned earlier, the stigma still sits there that if it's not physical, it's not happening. So just simply calling it domestic abuse rather than domestic violence alone is a huge step change. And in understanding this is about control. It's all about power and control. It's not about the physical signals of what's happening.
Thank you, Sue. It's been so interesting talking to you, and I've learnt loads today. I hope that we can all take some of that away into our workplaces with us and try to do better, especially in that 95% who don't have anything in place. So thank you so much for your time, and hopefully see you soon.
Great. Thank you for having me.